I'm going to try and lift those legs off from the ground using this stuff here. I can't do that, obviously. And then what I'm going to do is I'm going to hold. Once we've hugged our femur to our chest, we can rotate the tibia here. I want you to take the hands and try to lift them off the head without jutting your head forward. We're driving the feet upward. We're slowly engaging the stuff on the back side of the legs. We're going to take the hand, rotate a little further, and then I want you to try and contract this stuff, this internal rotator stuff, that would keep the leg or keep the tibia in internal rotation. Imagine that our pinkies are sitting on top of a shelf or a dresser. So we don't want them to fall off the dresser. We don't want them to lift up off the dresser. Hold it there. So if you need to hold it there, hold it there. If you can release it, release it. Seated knee cars. Okay? I'm going to hold my leg here in a seated position. I'm not going to hold it super tight. And what I'm going to do is I'm going to rotate my tibia into internal rotation and extend. Bring it back, rotate into external rotation, extend. Back, rotate, extend. Okay? Because of the position in relationship to gravity, this is going to bias the quadricep tissue a little bit more than it biases the hamstring flexors. But remember that rotation of the tibia places demands on the hamstrings. So the hamstrings are required to pull in order to create that rotational movement. We're going to do internal rotation pails and rails for tibial rotation. Okay, so I'm going to start and take my tibia into as much internal rotation as I can. I'm going to take my hand, I'm going to place it on the outside of my foot, and I'm going to try to squeeze a little bit more rotation out into internal rotation. I'm going to hold that for 2 minutes. After 2 minutes, I'm going to begin to try and rotate into external rotation. So that direction against my hand, getting heavy, ramping up over time to my maximum effort, using this outer part of my hamstring. So you should feel that stuff contracting on the outside of the leg. My rails contraction is going to be trying to get more internal rotation going that way, so away from my hand. And that's going to ask me to place demands on this tissue here as I try to rotate further into internal rotation. One way we can ramp up our intensity of our knee car is to hug our knee or hug our femur to our chest. Once we've hugged our femur to our chest, we can rotate the tibia here. Okay, so we've got internal, external rotation. And from here, we're going to extend, squeeze out as much as you can, bring it back, externally rotate, extend, squeeze, good. Internally rotate, extend, and back down. So we're going to do internal rotation passive range holds. How do we set up for that? Well, we first take our tibia into as much internal rotation as we can. We're going to take the hand, rotate a little further, and then I want you to try and contract this stuff, this internal rotator stuff, that would keep the leg or keep the tibia in internal rotation. So contract it as hard as you can, and in 3, 2, 1, you're going to let go of the hand. You're going to try to maintain that, hold it, hold it, hold it, and then parachute out. Seated loaded knee cars. So we're going to situate ourselves here. We've got an ankle weight on the ankle, and we're going to go into internal rotation to start, and then I'm going to extend, squeeze, so you're getting some quadriceps action. You're going to bring it back into flexion, rotate into externally rotation, flex, or extend, and then flex again, internally rotate, flex, back in. Seated knee cars. Okay, I'm going to hold my leg here in a seated position. I'm not going to hold it super tight. And what I'm going to do is I'm going to rotate my tibia into internal rotation and extend. Bring it back, rotate into external rotation, extend. Back, rotate, extend. Okay, Because of the position in relationship to gravity, this is going to bias the quadricep tissue a little bit more than it biases the hamstring flexors. But remember that rotation of the tibia places demands on the hamstrings. So the hamstrings are required to pull in order to create that rotational movement. Today we're going to just go through some movements that you can do in a very short period of time just to get your shoulders more active, gain a little bit of strength and awareness of the joint. We're going to start out as always with shoulder cars, just so you can get the shoulders primed and ready for action, bring the awareness in. I guarantee you, you probably didn't do your shoulder cars today. So if this is the first time doing your shoulder cars today, excellent. If this is the second time doing your shoulder cars today, awesome. We're going to start out with the arm in external rotation. We're going to move across the body into abduction. So move as slowly and as deliberately as you can. We're just moving 1 mile an hour until we get into overhead flexion. Our bicep is next to our ear. Now we're going to move into internal rotation, taking the X on our bicep and taking it away from our ear as we move into internal rotation and extension. Move into extension, as much extension as you can. Come all the way back until you get the back of the palm next to the pocket. We're going to extend back, rotate into external rotation, sweep up and overhead, across the body, and back down. Let's do the other shoulder. External rotation, come across into abduction, up and overhead, rotate into internal rotation, extend back behind you until the back of your hand is next to the pocket. Extend, rotate, up into overhead flexion, come across the body again into abduction, and back to start. I want you to do a few reps on each side, nice and slow and controlled, be very deliberate, be very aware of what's going on in your shoulder joint today. Next, we'll do scapular cars. So I'm going to have you just have your palms at the sides of your pants. You're going to take your middle finger on the inseam. I want you to imagine that's a train track, and we're going to keep it on that inseam. So we're going to bring the shoulders up to the ears, like we're saying, I don't know. Being careful not to bend at the elbows. We're not trying to reach for our guns and holsters. We're going to just take our shoulders up towards the ears, arms are straight, like we're saying, I don't know. We're going to bring the shoulders towards each other like they want to kiss each other. Bring them down as far as we can, trying to drop those scapulas into our back pocket. And then we're going to take the backs of our shoulders towards each other. So the front is moving away, the back is coming together, and then elevate. We're going to reverse that. Bring them back towards each other. Depress into the back pocket. Bring the shoulders towards each other, and then elevate. Okay, so that's the first way we're going to do our scapular cars. I'm going to have you do 3 reps each direction, and then we're going to move to this second version of scapular cars, which I really like. I like you to have your arms out in this sort of scaption position. This is called scaption here. So our arms are out like this, like we're going to hug a big tree. And we're going to imagine that our pinkies are sitting on top of a shelf or a dresser. So we don't want them to fall off the dresser. We don't want them to lift up off the dresser. This is only a scapular movement. So we're going to take our fingertips and we're going to try and bring them away from us. So we're trying to bring them towards, away from our body. So our fingertips are reaching out as far as they can. And then we're going to take the ears up towards, or our shoulders up towards our ears. We're going to slide our pinkies across that shelf, bringing the shoulders back. We're going to depress into the back pocket and then bring the pinkies or bring the fingertips away once again. We're going to reverse that, bring the shoulders back, elevate, bring the pinkies or bring the fingers away from each other again, and then depress. Okay, I want you to do a few reps of that. And then we'll come back and do a few more shoulder exercises. So we're not really looking to blast open any new space today, so we're not going to have any pails and rails contraction. These are going to be all things that you can do standing or seated or wherever you're at. I want them to be accessible, and I don't want you to be spending too much time just kind of hanging out. I just want this to be a movement snack, a mobility movement snack. So we're going to do some rotational capsular cars. So I'm going to take my arm into a 90-degree position, and I'm just going to imagine I'm doing that exercise that everybody gets at the physical therapy office. But instead of just doing it in this line of motion, I'm going to have you just move through and imagine you're also doing a car at the same time. So we're going through our car, we're going into an overhead motion, we're going to continue on into extension, and we're going to bring our arm back to here. And then we're going to reverse that, continue on into extension. Once again, going up overhead. So I want you to move through all that motion that you would do during a car, but we're now doing some axial rotation. So we're just kind of taking the bone and we're moving it around as we go through our car. So normally in our cars, we just go through that straight motion. Now we're taking the bone and we're doing this. So we're just trying to move through all those spaces and see how much rotation we can get through all those spaces. Now, once again, if you're feeling any kind of joint pains or there's any sort of pinchy points, I want you to go around those points. I don't want you to go dive straight into them. Okay, so I want you to do 3 to 4 reps on each side of those capsular cars along with the regular kind of car motion, and then join me back here. All right, the last motion we're going to do for today is a swimmer hover. And it's not going to be a prone swimmer hover, which is on the ground. We're going to have you standing to do these swimmer hovers. So I'm going to have you start with your hands behind your head. You're going to open the elbows, squeezing the shoulder blades together. And then what I want you to do is I want you to take the hands and try to lift them off the head without jutting your head forward. So lift them off the head. From there, I want you to extend the elbows. So you're going to reach out like you're doing YMCA. Then we're going to do this part of our cars where it's normally internal rotation, but now both of our shoulders are going at the same time. And so we're going into internal rotation and extension behind us. So we're getting as much of that extension as we can. And now that we have that extension, our scapulas are squeezed together, I want you to bend the elbows and set them down behind you, and you can relax here. Then we're going to re-engage, open in the chest, pulling the scapulas together, lift the palms or back of the palms off the lower back, hinge at the elbows again. You're going to now externally rotate, sweep up overhead once again into that Y position, and then I'm going to have you bring the elbows or bend the elbows again and bring the hands down, back behind the head, and set them down. That's your swimmer hover. I want you to do about 5 reps of that, and then that'll be the end of your mobility snack. Let's do a quick hip mobility snack. Okay, so I'm going to stand holding on to something, a dowel, you can be next to a wall, whatever you like. And I'm going to start by imagining everything on the opposite side of this left hip is going to be in a block of cement. I don't want any movement through any of that stuff. So the only thing moving is going to be through this hip. I'm going to slide my leg forward just a little bit. I'm going to bring my leg across the midline of my body, trying to squeeze that inner thigh stuff. I'm going to scoop up into a hacky sack position, trying to scoop out as much external rotation as I can. Once I run out of external rotation and flexion, I'm going to begin to move out of external rotation, try to squeeze out a little bit more flexion, move into abduction, so I'm moving away from my midline, opening up all this stuff here. From here, I'm going to begin to rotate this bone in the joint. Okay, so I'm rotating into internal rotation, show you from the side, rotating into internal rotation, being careful not to dump through the back. So rotating and then moving this leg into extension. So squeezing this stuff back here to try and extend and then bring the knee together here. I'm going to reverse that, extend the leg back, squeezing this stuff here. I'm going to abduct, pull away from the body, and I'm going to externally rotate. As I'm externally rotating, I'm moving back up into flexion and abduction, back to the front here. So abduction, I'm now moving across the midline, trying to move into external rotation, squeezing out as much external rotation as I can, coming across the body and back to the start. Okay, I'm going to have you do 3 reps on each side before moving to the next movement. Pause the video here, complete your 3 reps, and then continue on. Okay, we're going to do internal rotation pails and rails. If you don't have a yoga block, you can use your fists and just keep your fists in this position here. I'm going to use a yoga block, place it between my knees. I'm going to rotate my bones out. I'm going to walk my feet using my feet to create that rotation of my femurs and the hip joint. I'm going to walk out as far as I can, looking for a stretch in the back of the hip there. Okay, I found a stretch there. I'm going to hold that stretch for 2 minutes. After 2 minutes, what I'm going to do is I'm going to begin to drive the insteps of my feet into the floor. I'm trying to do this motion here. But the floor is going to be the thing that resists. I'm going to ramp that up, and I'm going to hold that. I want you to hold for 1 minute, like a nice long 1 minute contraction, trying to find that stuff that rotates you into this movement here. That's going to be your pails contraction. Your rails contraction is going to be trying to rotate the opposite direction. So after 1 minute, you're going to go the opposite direction and try to make the instep of the feet light as you try and do this motion. You're trying to do that motion there. Okay, so you're squeezing this stuff on the outer hip, trying to do that motion there, and trying to squeeze out and open up and find more internal rotation of those hips. Pause the video here, take your 2 minutes to stretch, and then do your 1 minute pails contraction, followed by a long 30-second rails contraction. Now that you've finished your pails and rails, we're going to do another set of cars. Save our information. We're going to bring our leg across, scoop up into external rotation. You remember this from the first round. We're going to go into abduction, internally rotate, sweep into extension, bring the knees to join each other. Extend back, externally rotate, pass back through, find as much external rotation as you can, adduct, squeeze those inner thighs together, and return back to start. I want you to do 3 reps per each side. We're going to do passive range holds here. So what I'm going to do is take the yoga block between the knees, or once again my fists here. I'm going to try and hold that yoga block between the knees. I'm not squeezing it, I'm just holding it there. I'm going to go into as much internal rotation as I can. I'm going to try and lift those legs off from the ground using this stuff here. I can't do that, obviously. And then what I'm going to do is I'm going to hold, lean back, hold until I fail through that motion there. Okay, so I'm trying to hold that passive range until I kind of fail through and can't contract anymore. Finish this off with 1 more set of cars, 3 to 5 reps on each side. Hey, what's up? Welcome to your 15-minute mobility snack. Today we're going to be working in happy baby pose. So for all you yoga people who are familiar with that pose, you're going to enjoy this. So we're going to start out as usual with some hip cars. Remember, rotation is the fundamental movement of the joint. So we're just going to start out with a couple reps on each side as we normally do. So we're going to take our palms to the side, bring the knees in very close to one another, and we're just going to bring our right leg forward. Bring it out, internally rotate, sweep around, join the other leg, extend back, working around, showing the inside of your leg to the floor, bring that knee up to the armpit, into flexion, back across. One more time, out, up, out, internal rotation, swing it around, extend back, open,
sweep around, and back. Now we're going to switch to the other side. Forward, open up, internally rotate, sweep around, join the other leg, extend back, open, sweep around. Now if you haven't done hip cars with us before, or this is your first video that you've had an opportunity to watch, I advise you to go back and take a look at some of our cars videos so you can have an idea of how to move through these cars. Open up, braid up, and return. Good. All right, so happy baby pose. For those of you who don't know what happy baby pose looks like, it's a deep hip flexion pose. So we're going to roll back onto our back, and we're going to assume this position like a happy baby. My daughter loves this position herself, and for some reason she just does it naturally, and this is one of those yoga poses. So we're going to take both hands to the outside, and we're just going to gently pull down into happy baby. And from here, we're just going to hold this position. Now, this is a deep knee flexion or deep hip flexion position. We're getting a stretch on the back side of our legs here. And in yoga, most of the time, you may just spend a little bit of time here just breathing. And for the most part, it's a very passive activity. We're going to spend a couple minutes here just to allow our nervous system to kind of calm down and allow the tissues to become comfortable in this position at this length, at this depth. Now, as I've mentioned in some of our other videos, when you're in this particular passive stretch position, we just want to give our body an opportunity for the fight or flight and for that stress of being here to kind of relax, allow that tissue to dissipate, allow it to kind of less tense. So that's why we're using the breath as you would use it in yoga. One of the other things that's important about this position here is it's very similar to a position you'd be in a deep squat. So if you are someone who squats a lot and you do a lot of that sort of thing, this is great for you. If you don't squat a lot and you want to get into a deeper squat, this is also going to be good. Remember, our passive range is what gives us the potential to create force. So passive space gives us the potential to have to create active force. So we've been here for almost 2 minutes or so, and now our tissues are nice and primed for some activity. And our first movement, we're going to work into our progressive tissue. Now you're going to stay in that position and hold it. I'm going to move out into a half position just for a moment. So that's this tissue here. This tissue is stretched. That's our progressive tissue. We're going to start to try to engage that tissue. But the very first thing we're going to do is sniff some air into our abdomen. We're going to make our hands really heavy. We're going to pull our shoulder blades back. And we're going to begin to drive our feet towards the ceiling gently, ramping our way up over time. Now you're going to ramp up to your greatest, safest effort or maximum voluntary contraction over time. So we're just going 20%, 30%, 40%, 50%, 60%, 70%, 80%. You're trying to drive those feet through the floor, but your hands aren't letting it. Fight, 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 fight. 3, 2, 1. I'm going to have you pull the knees forward towards your chest. So pull using the stuff on the front of your legs to pull the knees deeper into that deep stretch. So now your feet are not trying to go up towards the ceiling. They're trying to come down towards the floor. Really work those hip flexors. Pull, pull, 2, 1. Parachute and relax. Good. Take a couple breaths here. So on that pull towards the floor, what we're doing is we're trying to imagine that between our abdomen and our thigh, we had a stack of $100 bills that we didn't want somebody to pull out. So we're trying to pull our thighs to our abdomen so that they can't pull that out. Okay, we're going to slowly begin to ramp up again towards the ceiling. We're driving the feet upward. We're slowly engaging the stuff on the back side of the legs, creating tension. 50%, 60%, moving that needle up, 70%, 80%, maximum voluntary contraction, greatest, safest effort. And in 3, 2, 1, pull the other way. Pull, 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 pull. Bring those knees towards the floor. Give me more. Squeeze it in there. Give me more hip flexor. Squeeze that stuff. Somebody's trying to take that money. Don't let them take that money. You earn that money. 3, 2, 1. Parachute back into the hands. Good. Take a couple breaths here. Don't come out of that depth. Don't come out of that position. You're at the deepest point you've been in a long time. Don't lose this money. Going to slowly begin to ramp up again towards the ceiling. Tissue on the back side of the legs ramping up over time. 30%, 40%, 50%, 60%, 70%, 80%. Greatest, safest effort. Give it everything you got. Push, push, push towards the ceiling. Push. It's like you're pushing out of a deep squat. Push, 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 push. And in 3, 2, 1, pull. Pull those knees down. Activate those hip flexors. Squeeze them. Squeeze them. Come on, give it everything you got. This is our last set. Give it everything. Everything. Come on. 3, 2, 1, and relax. Good. All right. We're going to gently and slowly come out of that. So starting with bending the legs. Good. Slowly bring the knees down. Woo! Shake those hips out. All right, next up, what we're going to do is we're going to go back into that pose again. And what we're going to do is some passive range holds, okay? So what that means is we've got to activate the stuff on the front side of our legs and everything to keep us in that passive depth that we get to, okay? So legs are back up. Grab our hand, take our hands on the bottoms of our feet. You're going to pull down into that passive range. Good. Back is flat against the floor. Sniff some air into the abdomen. Activate everything you need to keep your feet there. And in 3, 2, 1, remove the hands. Keep those feet there. Keep those feet there. Keep those knees down. Pull, pull, pull. And 3, 2, 1. Good. Grab the legs. Breathe. Take a couple breaths. Pull yourself back into that deep stretch again. Sniff some air into the abdomen. Engage everything you need to hold your legs here. And 3, 2, 1. Hold. 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 Don't let those heels come down. Don't let those feet move. Don't let those knees come up. Don't let that money go. 2, 1. Parachute. Relax. Grab those legs. Again. Here we go. Last one. Pull down. Engage everything you need to hold your legs here. Sniff some air into the abdomen. And 3, 2, 1. Hold. Hold. Fight for it. Fight for it. 5, 4, 3, 2, 1, and relax. Good. That's an unhappy baby now. Whew, we are not happy babies anymore. See, it was happy baby when you were just chilling here, but it's not happy anymore. All right, so we're going to bring this leg, our right leg down. Actually, let's bring both of those legs down, give them a little rest, shake them out just a bit. Good Lord. And then you're going to go into half happy baby. So actually, we're just going to bring that in. So instead of happy baby, we're going to be in the same position we would be in happy baby. We're just going to have that deep knee flexion or hip flexion again. And from here, we're just going to do some hinges. So we're going to keep our leg in that position, deep hip flexion, and try to extend. Good, bring it back. Extend, bring it back. Extend, bring it back. 4, bring it back. Cramp City. 5, bring it back. Good. Whew. Bet you never felt your legs feel like that. Ever. No matter how many leg workouts you did, you're going to feel like you skipped leg day. All right, bring that other leg in. Hold it there. So if you need to hold it there, hold it there. If you can release it, release it. From here, straighten that other leg out, drive it into the ground, and hinge. Knee hinge. 3, 4, 5. Good. Woo. Lord have mercy. That was all bad. Feel sorry for you. Anyway, we're going to lay on our side. So we're going to do some side lying hip cars to finish these off. So I'm going to start here. Since I don't have a block to lay my head on, I'm going to just use my hand, my arm here. Bring the other arm out in front. And then I'm just going to sweep the leg up. Open. Internally rotate. Sweep around. Open. Sweep around. Good. One more time. Up. Open. Internally rotate. Sweep. Good. Extend back. Open. Sweep around. Good. Let's hop over to the other side. This side, leg straight, and then knee up, open up, internally rotate, sweep around the joint, extend, open, knee up, swipe around, again, knee up, open, sweep around into internal rotation, join the knee, open, extend, open, knee up into the armpit, sweep back around. All right, hopefully you enjoyed that 15-minute mobility snack. Your hips are important, as we can't stress this enough. So next time you're doing happy baby or next time you're in yoga class, just think about actively engaging that stuff, so you've taken it into that passive range. And if you're in that passive space, you can do a low level contraction at that point, just to kind of give you some feedback there. But think about it as you're doing your yoga practice more often. We want to create strength at length. We don't just want to have passive length and sloppy joints. Create the strength that you need to hold that length, to hold that joint in that position. And that way you'll be more safe and more effective as you go to do the things that you want to do in life.